Hello, everyone. My name is Kunle Adewale, and I'm your host for today. Welcome to day 5 of the National Art and Health Week in Nigeria. And I'm so excited to welcome our speaker for this afternoon. And this we're going to be looking at improving blood availability, use arts, technology, and advocacy. Today, our speaker is Bukola Bolarinwa, who is the founder of Haima Health. She's also a Queen Young Leader in the UK. I'm going to read about her very quickly. Bukola is a lawyer, sickle cell and blood donation advocate, and the founder of Haima Health. Haima, which is a Latin word for blood, has been growing progressively since its inception in 2016. Bukola began Haima due to her personal experience living with sickle cell disease and leading the Sickle Cell Aid Foundation. She was inspired to start it because people living with sickle cell disease often need blood transfusions, but struggle to access it due to poor donor culture, logistics challenges, and high cost. Bukola leads a team of staff and volunteers to carry out activities to raise awareness about blood health, sickle cell disease, and blood donation across Nigeria. This year, she began Mobile, a logistics service to support patients with blood delivery across Lagos at a subsidized fee. For her role in health advocacy, Bukola has received numerous awards, including the Future Awards, Obama Foundation Africa Leaders, and the Queen's Young Leaders Award delivered by Her Majesty, the Queen of England. Ladies and gentlemen, I present to you our honorable speaker today, Bukola Bolarinwa. Bukola Bolarinwa, you're welcome on board. Bukola, are you there? So, okay.
Thank you so much. Thank you very much for the introduction, and thank you so much. Clearly, maybe I should drop off and come back on. It's just calling.
Yes, you can, please. Yes.
I can hear. Been working as a sickle cell advocate with the Sickle Cell Aid Foundation. Something that we have tried to do is think about alternative ways to support people living with sickle cell. And I know that Kunle has been doing a lot of work in that space, especially even just from basic things like designing the spaces in which patients have to be at. So I remember a project working with the Sickle Cell Foundation in Lagos, in Idi Araba, just making sure that the spaces in which patients, especially children, are being admitted to are colorful, that the spaces there don't remind them, of the kind of situation that you're in, because part of the issues with people living with sickle cell is that frequent hospital admissions. You spend so much time the hospitals, both for routine visits and outpatient visits, as well as inpatient admissions. And so really thinking through, apart from the medical side of things, that obviously people like us have very little say about, what else can you do within that environment to support patients' well-being, to support patients' recovery. And so meeting Kunle all those years ago really allowed me to start to think through the programs that we were also doing to support people living with sickle cell, and asking ourselves, okay, within the programs that we are currently running, how can we incorporate arts and other aspects of well-being, other aspects of mental health within the programs that we're running. And so a lot of that has been really through incorporating music into our programs, right? And so I remember a lot of times when we have programs, because what we're talking about is very medical, there's a tendency to want to make it very serious. Everyone is like super serious, loads of suits and formal situations. But then we thought about, okay, how can we constantly incorporate music when we have our programs? So for example, a good way we've done that is through our warrior support program. We have a lot of people living with sickle cell that we support as beneficiaries. And usually when we have a gathering, to teach them about their health, to teach them about various things such as nutrition, which is also something else I'm quite passionate about. We make sure that we have music playing. We make sure that it's an environment where people can dance, people can thrive, people, despite their limitation, can have a good time, because there's something about the arts in its various forms that uplifts the spirit, and that I think isn't explored enough, especially for people with health challenges. I think that now, especially given like the rise of Nollywood, the rise of Afrobeats, the rise of, the arts as a whole, we're seeing a lot more people thinking about how do you extract elements of those those fields into the various programs that you're doing. And I think that is something that a lot of us need to also think through. Another really good way in which we incorporate both is through theatre and film. So I'll start with theatre. Another thing we've been very good at, especially for young people, students in particular, is using theatre and plays to demonstrate how important it is to know your genotype. So we've put on plays at secondary schools where the students themselves, we ask them to write the script, and given the messaging that we're trying to put out, right? What's the basic messaging? The basic messaging is know your genotype. The basic messaging is make informed decisions before you have children, because those decisions can affect whether or not your child has sickle cell. And we present it to kids as young as 13, 14, 15, and we say, this is the message that we're trying to put out. How can you use theatre or play to deliver this message? And you'd be surprised at how creative that children can be, and how well they're able to interpret that message using play, using music as a way. And also to remove stigma, because that's another issue that a lot of people in the sickle cell community really suffer, is that trying to go away from that word sickler, trying to look for, a way to spin living with sickle cell as not a death sentence, in quotes. Because another thing we found is actually when we worked with teenagers, if you say, oh, what are your first couple of what do you think about when you think of the word sickle cell? The first thing every secondary school that we've gone to do this is that, oh, they are going to die young. That is a common theme, and I don't know how that has been taught or where those things have come from. So we then challenge those students to say, oh, actually, what do you think somebody living with sickle cell looks like? And if I say, oh, I have sickle cell, they'll say, oh, you don't look like someone that has sickle cell. And so then trying to remove those like misconceptions from them, we challenge them to say, okay, can you put on a play about this? And in the play to be like, oh, the most script to be like, this man married this woman, and then they had a child, and the child was always sick, and then the child died. And we then have to come back and say, oh, actually, what if the child didn't die? What if this happened? What if that happened? And using theatre and using play and using script writing, we're trying to teach the children to think positively about sickle cell and some of the challenges that come with it. The second way, like I mentioned, is through film. So we've done a number of short films, and actually for World Sickle Cell Day, which is on June 19th, we are going to be putting on a movie screening of a short film that we've done on sickle cell, just really looking at the pain and the crisis and those issues that come with it. And so film is another way in which we try to incorporate the arts with the messaging that we are trying to put out, right? Because again, if you put it in the medium of a film, it's a lot easier for people to digest the message without, again, feeling like it's too serious or you're jamming it down their throats. And then coming down to blood donation as well, which is obviously the second thing that I do. A lot of what we've looked at doing is targeting events where you wouldn't traditionally think about health. So music concerts are a really good one. especially in religious organizations where they put on plays and they put on things like that, churches in particular, and targeting those events and saying, hey, listen, while you guys are doing here, do you know that you can register as a blood donor? Do you know that you can sign up to be a blood donor and it's only going to take you 30 minutes and so on? Sometimes we have blood drive at those kinds of events as well. It is very challenging. I'm not going to pretend like it's easy because again, a lot of people have a lot of misconceptions about blood donation, right? And there's so many excuses I've heard about why people don't want to donate. From people saying, oh, I don't have enough blood. What are I going to do with my blood? I can sell my blood and so on. And so using those kinds of informal settings where it's a little bit easier for us to spread our advocacy, spread our message and tell people, you know, hey, if you donate blood, this is what happens. You can save up to 3 people by donating 1 pint of blood. You can donate up to 4 times a year. But passing these messages in informal settings where the creative arts are being used is something that we found that works quite well, much better than targeting sort of very traditional engagements such as like conferences and maybe where there's like traditional religious worship, because then people are just in a mindset that's a little bit more serious and then they just don't feel that need to engage. And finally, I guess my last point before I pass it over to Kunle, so I don't like go on for too long, to maybe ask any questions or see the future, is that a lot of the work that we do targets young people, and young people are always interested in the arts, especially in Nigeria. And so it's very important for us, and I think for everybody involved in health advocacy, whatever that is, from HIV to cancer to whatever, to think about what is the main messaging that young people consume in Nigeria, and how can you make sure that your messaging ties into the messaging that they are already consuming, because trying to get them to consume messaging in a new format is actually quite challenging. And so for us, and I guess the challenge for everybody working in the health advocacy space is to think about how you can incorporate yourself into the way that people are already consuming media, whatever form of media that is. And that includes social media, of course, right? In the form of skits, in the forms of TikToks, where the messaging is a lot shorter. Like trying to think about how can you put your messaging in the formats that young people are going to consume and that they're going to engage in. Sometimes it could be funny, right? It doesn't necessarily have to be serious all the time. There are lots of really great young people, especially on Instagram and TikTok, that do videos on sickle cell and blood donation, and they have these memes about, oh, when you go to the hospital and the nurse says, oh, is it you again, something like that, and make jokes about it, just to get people engaged, like I said, in the form that they like and in the form that they enjoy. So I would say that is the end of my presentation. It's pretty short, but yeah, those are the key points I wanted to make. And I'll pass over to you, Kunle, if you have any questions.
Of course, I do have question for you. I did here for you. I'm ready for you today, not today. All right. Incredible, incredible. I mean, knowing fully well, I mean, how you started and how you're thriving, for me, it's just incredible to see the fusion of the media and also entertainment and art into health. That is very cool. And in a way, it helps to really make your advocacy work in a way penetratable, in a way that it penetrates different space of the society, and the messaging using themes. People watch a lot of stores on social media, and you creating content that people can really make use of. So I think it's just incredible. So I have a few questions for you very quickly. What would you say has been your biggest challenge in this area, in this field of advocating for blood donation? What has been your biggest challenge as somebody who's driving this initiative?
There are so many challenges, but the biggest issue is really the fact that not enough people donate blood, and not a lot of people are interested in donating blood. Now, that's for a number of reasons. Number one, being socioeconomic. If people are hungry, if people are jobless, if people are depressed, if people have concerns about security, healthcare, they are not going to donate blood because the issues in front of them are just too much. And so oftentimes we have to target people who are relatively well off, especially the middle class and the educated. A lot of the people that donate blood from lower socioeconomic backgrounds expect to be paid, and we don't pay donors. And we try to discourage people from paying for blood, because then it becomes a vicious cycle. So that is a big challenge. And obviously that limits your pool, because everybody says, oh, Nigeria has 200 million people, so you should be able to easily get donors or whatever. But if out of the 200 million people, first things first, maybe 60 or 70 million are below 18, then out of that, another 70% are basically hungry. So they are not going to donate. So then your pool is actually pretty limited. And then by the time you take out people that have pre-existing medical conditions, people that are overweight, people that have low hemoglobin and all that, you're left with actually quite a very small percentage. And then trying to convince those people to understand the need for donating blood is a very, very big challenge that, yeah, we still haven't been able to solve, and it's something that we continue to work on. I think the number 2 challenge is that even within that pool, there's a very low trust in the healthcare system. And nobody trusts the Nigerian healthcare system. It has failed a lot of people, and it doesn't have a good reputation. The process of donating blood itself is not seamless. And so there's a general conception that people sell their blood, and a lot of private hospitals do, private blood banks do sell blood. And so there's a business in blood, right? So it's like, oh, why should I give you my blood for free when a patient requires blood in the hospital, you are going to charge them for the blood? And yes, patients are charged for blood. So our challenge is really trying to explain to them that, well, you have to charge for blood because blood has to be screened, right? You can't donate, Kunle cannot donate blood directly to Bukola. If you donate blood, it goes into a system, and there are several tests that have to go, that have to take place before it can be safely given to somebody else. And so trying to get people to understand that there is a process, and blood itself is an input, it's a medical input. So the same way you charge for oxygen, right? In the hospital, people say, oh, but oxygen is free. Why do you charge for it in the hospital? It's an input. So, you will charge for it. So the question then is, we have to then get people to understand the kind of healthcare system we run in Nigeria, which is essentially like a mixture of public and private. So I would say that, I could list a whole lots of other challenges, but I would say those 2 are the biggest.
Hello, hi. Oh, my name is Adetayo. Okay, sorry. Hello?
Ms. Adetayo, please go ahead.
Hi, Bukola. Congratulations on what you're doing. The last thing you said was the point I was going to make. The healthcare system, people don't trust in the healthcare system. Is there any way you think, especially with the government hospitals and things like that, that we can do an awareness to make people, do you understand?
To make people do what?
To make people understand and know that, giving blood is not, because some people think, oh, if I give my blood, I'm not going to wake up tomorrow, I'll be dead, and all sorts of things. The other thing is, even in receiving the blood, do they screen the blood properly in the system? I'm asking, like, in the system, is the blood well screened?
Yeah, so your first question.
Sorry, I'm thinking of 2 sides, the giver and the taker.
Yeah.
Do you see what I'm
Yes.
I'm saying? So, thank you.
No, you're welcome. Thank you. Those are great points. And to the first point, if you have any tips for us, that's really the focus of a lot of my work. Is we do radio rounds, TV rounds, print, social media. We are constantly putting out the messaging on the importance of donating blood, the safety of donating blood, the process of donating blood. And so I guess all we can continue to do is amplify that message and hope that it reaches more people. The second thing about safety of blood. Yes, Nigeria has come a long way in terms of blood safety, especially in Lagos State and the FCT, where blood has to be certified by the state blood banks or the National Blood Transfusion Service in order for it to be issued out. And there's a series of tests that all blood has to go through before it should be transfused. So generally, the safety of blood in Nigeria has really improved over the last 10 years. Yeah. It's doing a lot better than before. There are very, very little cases of infection and so on compared to what it was in the past, because there's now better processes that are in place. But again, it's like trying to get people to understand that message is the constant challenge that we have, and is what we continue to work on, really.
Congrats again.
Thank you.
Congratulations.
Incredible stuff. Thank you so much, Ms. Adeteo, for asking that question. I'm going to ask this question as well. So what is the demand like? You spoke about the demand for blood donor. What is it like annually, monthly, or quarterly? What is it like? What is the demand like? And how are you meeting this demand?
Yeah, so the demand for most countries is for 1% of the population to be regular voluntary blood donors. So in Nigeria, that's about 2 million people to regularly give blood. Men can give blood 4 times a year, women can give blood 3 times a year. And so what we need is for about 2 million people to consistently give blood throughout the year. The main challenge is obviously, again, is that a lot of times when people give blood, and I've accused you of this, Kunle, is that they've done it once. They'll say, "Oh, yeah, but I've given blood. That's all. I've done it one time. Why are you coming back to me?" But then it's getting people to understand that the need for blood is constant. Every day there are people in hospital that need blood. Especially women who are in labor, having children, neonatal, that's children who are born either premature or have certain infections, people like me that have sickle cell disease, people with long-term conditions such as cancer and leukemia, and then accident and emergency victims. So a good example is when recently during the Kaduna train attack, we had to have an emergency blood drive where we had about 25 people come to donate because the hospital in Kaduna was actually flooded with victims from the train attack. And in that kind of situation, you go from, maybe you've had a certain amount of blood in the stock room where you think is going to be enough, and then there's an emergency, and then all of a sudden you need a lot more blood. We also had that in Lagos recently with the building collapse. And so when incidents like that happens, a lot of people call us, and then we have to quickly put together a blood drive to recruit people to come and donate. So the general need is about 2 million units of blood annually for Nigeria. It's not that much if you think about it, but it's just meeting the demand is very, very challenging. We are constantly in need of blood. It's never enough, especially in Lagos State. The demand is a lot higher than the supply.
I agree with what you said earlier on. I was just, as you were saying, I was just laughing in my mind. I remember recently when my new baby was about to be born, and I was asked to come and donate blood. I was so fearful. I was like, God, am I going to die? Those thoughts were coming through my mind. And then even when they were actually like in the process of doing that, I was, my reaction wasn't really good in a way. So I think there are people that have fears that donating blood will make them to die, or maybe after they must have donated once, don't even come back. I've given you one, that should be enough for the year.
Yeah.
Like you said. So, but not only that, at least you can actually do much more. So, and like Adeteo said earlier on, how do we build trust? Apart from building trust in the system, but building trust in people. How do we convince people? And how have you been convincing people? I mean, you've spoken about using different media and all of that, but what has this led to? You trying to convince people through your advocacy work. So what has been the result?
Well, I mean, so there's two parts of it. In some ways, we've been successful. We've registered up to 5,000 people as voluntary blood donors across the country, who we call on when we have blood requests. But the main challenge, again, is that the trust deficit isn't something that we can fix because we are not the government, right? Oftentimes, if I recruit you, Kunle, as a blood donor, and I say, oh, Kunle, this is what we're doing, come and donate blood in Lasut, for example, or Luth, for example, or, University of Abuja Teaching Hospital. When you get there, for example, and this has happened several times in situations for us, the donor gets to the hospital, they are kept waiting for ridiculous amounts of times. Sometimes they are dismissed for, silly reasons, and the general environment isn't positive. The people in the lab and all that are more interested in the money that they want to quickly make than the person that has left their house to come and donate blood. The attitude is ungrateful. It's very difficult for me to then call you again a second time and say, come and donate blood, because you've had a bad experience. And so that remains a challenge that really is difficult for us to solve. It really has to be from the government and the people that are working within those public institutions. So a lot of our partnership now is focused on the National Blood Transfusion Service and the Lagos State Blood Transfusion Service, because the service there is really great. I must commend the Lagos State Blood Transfusion Service in particular, because we've never had a situation where we send a donor over there to donate and they've had a bad experience. They are treated with a lot of gratitude, they're seen on time, the process is sanitary, the place is sanitary, and it's clean and all that, and people are generally more likely to come back to that place than to go to a big general hospital. And so for us, what we've had to do is now target where we are having our blood drives and the people that we are partnering with, to make sure that the donors that we're suffering to recruit are not turned away or treated in a way that will make it unlikely for them to come back.
Sorry, do you collaborate with the government, like Lagos State government, to make the awareness?
Yes,
like
yes.
asking them, okay.
Yes, so our main partners.
I was going to
Sorry.
thank Aditayo for that. I mean, you literally took that question out of my mouth, because that was my next question. That was my you saw through my mind. So you are saying well. You're saying well. You're in the spirit. You're in the spirit. Yes. So I was going to talk about how have you been collaborating with the government in your blood donation drive? How have you been doing that? So in terms of collaboration with government or government agencies, who are you collaborating with? Who have you been collaborating with? Who do you intend collaborating with? And also trying to look at in the place of policy. Are you looking at perspective about policy change regarding blood drive in Nigeria, and how?
Want to bamboozle me today, hilarious questions. So the first one, yes, our main partners are the National Blood Transfusion Service and the Lagos State Blood Transfusion Service. They are the only people that we work with to collect blood. We at the moment don't work with any private hospitals, because the private hospitals sell the blood for really, really high amounts, which is understandable because it's a private institution. So at the moment we only work with them. Sometimes we also work with Luth and the Sickle Cell Foundation and those kinds of organizations. But yes, those are our main partners, and we've been working with them now since we started for over 10 years. They've been really great, especially, like I said, the Lagos State Blood Transfusion Service. I've seen them really improve in how they're doing, and it's clear that they're very what's it called? They are very sold on the mission that they are there to solve. The main issue, obviously, is that the healthcare system is severely underfunded in Nigeria. So no matter how good your intentions are, the fact is that there's a limit into the amount of resources, there's a limit to the amount of manpower. They have limited staff, their staff have to work weekends and late nights and so on. So it's a challenge either way. So those are our main partners. In terms of policy, there isn't really any policy issue when it comes to blood in Nigeria. The policies are pretty clear, they're pretty up to date. We recently had the National Blood Transfusion Service become the National Blood Transfusion Commission. So it's now its own entity, and what they want to now do is regulate all the private blood banks in Nigeria, make sure that they are all licensed, make sure that all the blood that they're issuing out is safe, which is pretty good. So the policies are there. Like with everything in Nigeria, it's just implementation that's really the issue, making sure that things are properly implemented. So I don't really see any policy gaps within the space. it's just making sure that, you know, everything is properly implemented and we're able to really do the things that we say we are supposed to do on paper. So yeah, I don't know if you had a third question. Those were the two I remember.
For you, I've told you today.
Okay.
Good. So yeah, so you earlier on you spoke about stigma. I'm someone who is very pro advocacy for persons living with sickle cell on a big level, like for almost about 8 years now. I've been in that space, and I'm not going to leave. Right.
Yeah.
It's because it's something that is very, very important to me. As a child living with sickle cell disease or disorder, what was that like for you?
No, I didn't really know I had sickle cell until I was more of a teenager. By then I was a little bit more aware because I would fall sick often. So it was really like, why am I always falling sick type thing. So I would say I found out when I was about 13. I think I was in like just 3 also. I can't really remember, but like just 3 or so. And part of the reason my parents told me is because I was going on a school trip and they had contemplated whether or not you know, I should go on the school trip. And I really wanted to go. Obviously, as a teenager, you know, you want to do what your friends are doing, but they were also worried that I would go and I would fall sick and all that. So yeah, I think that was when I found out. And it came with challenges, obviously, up and down. I remember I wrote my work in the sick bay, and through you know, every time I had exams, especially mathematics, I can never forget, I would always have a crisis just because I had so much anxiety and I would panic and all that. And it was something that I was quite scared of. So it was really, I think the younger years were really just about learning about myself, learning about my body, learning about what my limits were. And so, you know, when you'd have crisis, is not understanding, okay, what are the triggers to this crisis? What are the things that, you know, make me have crisis? What are the things that make me not have crisis? Those years were more about learning about myself, learning about my body. So yeah, I would say they were pretty good. Otherwise, I had obviously really supportive parents, really supportive school, that allowed things to be, I know, much easier than a lot of other people living with sickle cell had it.
That's amazing. That's amazing. I was going to ask you as well, do you have success stories? What will you, I mean, from your own personal success story, from doing what you do, your organization success story from what you do as well, that you would like to share with us?
You mean for people living with sickle cell?
Yes, what are people living with sickle cell? Your personal story as somebody who has continued to champion this cause, your organization success story. So you say now as an individual, as a person, then now as an institution. So I'm asking about it too, yes.
I don't know. Am I successful? I don't really know.
No, I said
I don't
success
know.
stories, success stories. So you know success is progressive, right?
Yeah.
So I'm talking like you might have milestone that we're able to do X, Y, Z, you know, stuff like that. So
Yeah.
those are success stories I'm talking about.
Okay, so I mean, for SCAF in particular, I think a real success story for us was during COVID. We had a project, which is I think our biggest project to date, where we worked with Access Bank and a few other institutions in Nigeria to support people living with sickle cell during the pandemic. Obviously, when COVID-19 just came out, the immediate panic was that people living with sickle cell are more vulnerable, and that we want to make sure that they are as safe as possible. We want to make sure that they're still able to access their medicines and so on, while they are still trying to self-isolate and all that. And so we had a project where we distributed food, drugs, and all that to people living with sickle cell. For Haima as well, what we did was social distancing blood drives, because there came a point where there were literally zero blood donations. We had no blood in MBTS in Abuja at that point. And so we had to think about how can we have how can we continue to have blood drives during a lockdown when technically no one was supposed to move? So we had to have social distancing blood drives where we worked with MBTS to go pick up donors from their homes, take them to go donate blood, and then take them back. And then we had to have like badges to make sure that we're allowed to move. During NSAS as well, we also had a blood drive despite the fact that, Lagos State had a curfew, but we still needed people to go donate blood. And so we had to work with Lagos State Blood Transfusion Service to give them lists of donors where they could go there and pick donors up to donate blood. So I think recently those have been two really successful projects that I'm really quite proud of. And something that obviously we hope to grow, starting Haima Mobile as well, where we are looking to deliver blood directly to the hospitals, has also been quite a challenge. It's the first time we're actually doing something more from a commercial perspective to try and solve some of the issues with logistics and blood donation. So that's also been quite a challenge, and it's been quite interesting. So yeah, I mean, I think we've continued to explore, continue to grow, continue to try and think about innovative ways where we can support our community and get people to keep donating blood.
Wonderful. I know there's a question. I'm going to read that question very quickly. I still have like 2 or 3 more for you, or 4 or 5, but I'll go to this very quickly. Someone asked in the chat and the person says, is there any specific health benefit for the blood donor? How do you infuse such benefits in your art and media approach of advocacy?
Yeah, I mean, so there are a lot of health benefits to donating blood. The first is obviously that you get a free health screening. So before you donate blood, there are certain basic checks that are going to be done on you: your blood pressure, your hemoglobin level, your weight, and so on. So immediately you get a free health screening. We've had a lot of people that have tried to donate blood and didn't know they had high blood pressure, and didn't know that they had to take folic acid and so on. And by doing that, we also give out drugs when you come and to try and donate. And if you had any kind of issues, we give out vitamins and so on. So immediately that's the first benefit. Then also for you, it helps your heart to pump out brand new blood, helps with weight loss as well. So there are quite a number of benefits to the donor. But what we found is that actually communicating the benefits to the donor isn't really quite an incentive to people. Like, someone isn't going to leave their house to go to Wagada to donate blood because you tell them that it's going to improve their heart health, or because they are going to lose some weight, or because it's going to refresh their blood. People are just not that incentivized by that. And so we have tried that in our messaging. But usually what you find is that people that are interested in donating blood already are the ones that want to know about those benefits. Those things in itself cannot convince someone who's not interested in donating blood to donate. And so we do put out that messaging, but it's not really like a big focus for us.
Wonderful, wonderful. I'm going to ask this question while we're still waiting for more questions to come in. Still on the issue of persons living with sickle cell disease, I've worked with people who later died, those who had sickle cell, they died. And I remember there was a particular boy who was part of our arts program, and at the time I even tried to raise funds for him using my social media, and a lot of people sent him money. We were able to help him to open bank account, and later on he died. I came from a very marginalized community, and he was not able to make it. So for you working in that space, have you lost very close people or loved ones who are living with sickle cell disease? How did you deal with that?
Yeah, that's the biggest peril of this job, actually, is that I've lost so many people, so many warriors, so many advocates. I mean, it's really heartbreaking. But I've just used this as motivation to keep pushing. One of my closest friends, Nura, who is actually the person I took sickle cell advocacy from. So Nura was very, very vocal about sickle cell disease at a time when I wasn't. So even though I would go do sickle cell advocacy, I wouldn't necessarily talk about my experience. But Nura was always like, you literally meet him like, hi, my name is Nura and I have sickle cell disease. And he was very, very, proud of it. And he was very proud of the work that he was doing. And so Nura unfortunately died a few years back after a crisis. And that was really, really heartbreaking. In fact, I considered stopping the, advocacy work at that point, because it suddenly felt like pointless, like someone who was such an advocate, so intelligent, so driven, so committed, to just lose him like that. He was so young, he was like 24. And we lost him at State House. In fact, at that point, we wrote a petition against State House. We considered writing a petition against the hospital and the doctor because we felt that they were negligent. But eventually his family actually said we should just leave it, and that I think that it was just his time. So that is a very, very big challenge, and there isn't really any kind of solution, or I can't say that I have that part all figured out. It's just something that is really, really a peril of the job. And yeah, we just keep pushing. There isn't much we can do because we live in a country where the healthcare system is broken and it fails so many warriors at so many points. I think that for me is even the hardest. I don't even think that the warriors that we lose is as bad as the warriors that we're currently failing at so many parts, because so many things are not caught on time. So much of patients, so much of a patient's well-being is determined by their socioeconomic status. And I know that. So I look at myself, for example, I had a leg ulcer 2 years ago. Because I was able to be in the UK and get the kind of healthcare that I was, my leg ulcer healed in like 4 months. I have warriors now who have been battling leg ulcers for 2-3 years, and leg ulcers are awful. In case a lot of people don't know, they are one of the complications of sickle cell disease, and it's a wound usually on the legs that don't heal. And it's really, really sad to see how long they have to battle leg ulcers. They're constantly reoccurring because, number one, the healthcare system is terrible at taking care of it. Number two, a lot of them have really poor diet and nutrition. So if you have poor diet and nutrition, you're not able to afford constant supplements. The wounds themselves don't heal. And so it's just a heartbreaking combination of issues, really. And so, yeah, I think that those are some of the hardest things about doing the work that we do.
Sharing that, because I feel like, it gives us the reason why you do what you do. For me, it's more of that, like why you do what you do. I was going to ask you the question, like, have you ever thought of giving up? And I think you spoke about that a bit because, like, does it make sense? All of this effort, so this is it, right? So you mentioned it briefly, so maybe you want to, shed more light on it. Have you ever thought of giving up? And this is also like, it has a serious mental health effect, right? I mean, you're trying to care for other people, you try to champion this, and then you see people dying. It comes with its own depression, it comes with its own mental health challenges. How have you been able to cope mentally with all of these challenges, with the big work that you do?
Yeah, I don't know. I guess maybe because I'm religious as well. So I guess religion helps in terms of giving you something to hold on to, and thinking that there's a bigger reason that you're here and there's a higher purpose and so on. So I would say that is what I hold on to as a crutch. Yeah, I don't know. It's tough. In terms of like the way that things are, and I think what's even harder is the future outlook. In terms of Nigerian healthcare system, it doesn't look like it's getting better. I think that for me is even the most depressing part, is that we can't really say that, oh, actually things are getting better. And, I think awareness is getting better, especially for people living with sickle cell and their ability to advocate for themselves. But the healthcare system itself, no, not really.
Can imagine. Wonderful, wonderful. And I was going to, like, I mean, I know you're a person of faith. I know that, just like I am. our faith plays a big role in what we do and how we cope, with life situation. But apart from being a person of faith, right? You talk about music, you talk about art, how you use that to drive, blood donation through what you do. Would you say that all these artistic elements as well play a role or significant role in your well-being, your mental well-being? Would you say that? Maybe just say that very quickly, and then we'll take Mr. Detail they're doing next.
Yeah, of course. I mean, I love music, as you know, I love film, and all those things. I love like trying to incorporate them. Oh, sorry, I have to just give me 1 second.
So while we wait for Buki to check in very quickly with us, does anybody have anything to say? I can unmute you. Oh, Buki's back. She's back now, right? Okay, go ahead, please.
Yeah, sorry. Can you hear me?
Loud and clear, loud and clear.
So yeah, you was asking a question about faith, right?
So yeah, I said, apart from being a person of faith, which I think is very important in our lives as friends, and also, so what you do through your advocacy work, you mentioned art, media, films, and all of that. Would you say all of these elements as well play a significant role in your mental health and personal well-being as you deal with the gains and the challenges that come with working in a space like this?
Yeah, definitely. I think that those things have been sort of crutches for me, and I would definitely, ask people that in whatever kind of field that they are to think about how they can find elements like that, whatever it could be. It could be, I happen to like music and art and film, but for other people it could be like you, it could be like visual art, it could be anything. So I would always suggest that people try that, and find it as a means to just also get your mind off, all the issues, especially when you're dealing with healthcare, which can sometimes be quite heavy.
Great. So I see that Adetayo actually has a question for you before we close shortly. I'm going to ask her to unmute herself to ask a question as we just get ready to close this session very quickly.
Okay, thanks. Thank you, everybody. Hi, Bukola. I just want to say congratulations. But what I wanted to say is that, you were talking about religion, and foundation is very important, because if there's no foundation, how do we continue? And it seems like if the point of foundation problem is the health system in Nigeria, the current health system, the health system in Nigeria, can you think of any way we can do to improve the health system, whereby, because when we start from the foundation, then you're going to see it run right through to the top. Do you get what I mean? When the foundation in the health system is great, then nobody's going to be afraid of taking blood, because the way the health system is, in a correct way, because everything points back to the health system and the government, in inverted commas, because not everybody can go private. And the percentage of the poor people is much higher than the people that go private. So if the health can be there for the poor, then awareness comes in. Or what do you think? Am I going off point?
I actually think the foundation is actually the educational system, and I think that's where it really fails a lot of Nigerians in their health. The first thing first is that your health-seeking behavior is already flawed, because before the average person and the average person who has sickle cell goes to the hospital, they have drank agbo, they have smashed up some leaves to put up somewhere. They have, oftentimes by the time you're approaching the healthcare system, the situation is very, very dire. And so with already a limited healthcare system, it's a very bad combination. You're going when things are already really bad. Oftentimes, again, that's down to the socio-economic situation, right? It's like if I don't have money, if somebody gives me a go that's 15 naira, I'll obviously try that first before I go to the primary healthcare center where they will tell me to open card for 2K. I'll wait all day to see the doctor, and then the doctor writes medicine. I'll get to the pharmacy, they'll tell me that the medicine is not available here. I should take Okada and go to this other place, so the education is really, I think, what the main issue is: the understanding of the healthcare system, understanding of your bodies, and all those kinds of things. So I feel like if more people were better educated overall, even just the primary school level, they will be able to decipher a lot of things pretty quickly compared to having to wait until things are pretty serious or pretty dire. Obviously, then that also helps with being able to discern that, okay, there's a thing called genotype, and this is how it affects you, and this is how it could affect your potential children. All those kinds of things are a lot more difficult to explain to populations that are not very well educated. So I think really that's where the issue is. Even if you had a very, very good healthcare system, if the people themselves don't understand basic healthcare, don't understand health-seeking behaviors, and I think that you continue to have this kind of challenges that we have. But that's just my theory. I think a lot of the issues, are above my pay grade. So I don't try to think too much overall about the healthcare system because that would just give me a headache. I just try to focus more on the kind of work that we're trying to do.
Wonderful. Thank you so much, Buki, for the incredible work that you do. I mean, you are such an amazing and inspiration to me. I'm very proud of you and the great work that you're doing. I believe very strongly also that people on this platform today are inspired by your journeys. They're inspired by the kind of work that you do. And I believe very strongly more people that will be able to watch this recording as well will be able to think about what they can do and be part of the change, and we'll be encouraged to donate maybe like 4 times in a year, and the fear is no longer there, right? Thank you so much for
waiting
that.
For you to go first,
I will try. I will continue to do my best to just make sure I also donate as well. Thank you so much for the great work that you do, and we're going to bring this session to a close now.